Welcome to Follow the Medical Record, where healthcare experts give insights into the increasing importance of following a patient's medical record through the health ecosystem with compliance, privacy, security, and efficiency front and center. This podcast is brought to you by MRO and hosted by Don Hardwick, Senior Vice President of Client Relations at MRO. Don has been in the health information management industry for over 40 years and has extensive knowledge of how medical records make their way through the healthcare ecosystem. At MRO, Don is responsible for strategic client engagement programs and overall client satisfaction. To hear from all of MRO's industry experts, be sure to visit mrocorp.com for additional content and to sign up for our monthly e-newsletter. Over to you, Don.
Hi, everyone, and welcome to another session of Follow the Medical Record as we talk today about the exchange of clinical data between hospital providers and payers. I'm your host, Don Hardwick, and thanks for listening today. As always, you can learn more about MRO and myself on our website at mrocorp.com, and please take a moment to connect with me on LinkedIn. I'd love to hear from you. By the way, also follow us on Twitter at MROCORP. As my guest today, we have MRO's Chief Product Officer, Mo Weitnauer. So first of all, Mo, welcome to the show.
Thank you, Don.
To kick things off, can you tell our listeners a little bit about your background?
Sure, happy to, and I'm glad to be here with you. My role, as you said, at MRO is the Chief Product Officer, which is simply a fancy word that means that I develop new products and also improve our existing products to delight our clients and our prospects. So my team is really concerned with ensuring that we delight the market through technology and other supporting services. We do this by spending a ton of time with clients and prospects and watching what's going on in the market so that we're nimble and we are able to provide really winning products. Outside of work, here at MRO, I came to MRO after spending most of my career in product management and corporate strategy across the healthcare industry. So I've worked for provider-facing companies before, payer-facing companies, pharmaceutical companies. So I've kind of seen the full breadth of healthcare from all those different vantage points. Besides my very busy day job at night and weekends, I'm a mom and I spend time with my family. So happy to be here.
Well, thanks a lot for joining us today. I don't see how you do some of these things and be a mom as well. They're both full-time jobs. So I'm glad to have you taking the time out today to talk with us.
Well, somebody's got to do it, Don.
Yes, that is correct. I know since joining MRO that you and your team really have been focused on some significant projects, and one of those projects is clinical data exchange. Can you describe the concept and what that actually means and how it fits with the medical record? The focus of this program, Mo, is the medical record, and its usage is throughout different phases of the industry. So can you describe a little bit about how that clinical data exchange operates and its use of the medical record?
Sure, happy to. So we are very excited to have launched a new product in July of this year at the HFMA Healthcare Financial Management Association conference in Nashville. Payer Exchange is a new solution that sits on top of what we're calling a clinical data exchange platform. And I'll explain both of those for you. So I'll start with a clinical data exchange platform. The words mean something. So we are starting to talk about clinical data more broadly than just medical records. We know that medical record is really the comprehensive set of data that are within an EHR and sometimes actually outside of the EHR. So we want to exchange the actual data themselves that are included in a medical record, or it could be other clinical data that providers have in their systems. So you can think about images, you can think about components of a medical record, things like those. So we're really thinking about this holistically. The second word is exchange. So we know that release of information is really becoming a strategic center for health systems. And we want to make sure that requesters are not merely taking every time, but that there is a real exchange of information between providers and the various requesters that they interact with. What might that be? That might be things like statuses or the use of that record. And at times we are looking at actually sharing back clinical information to the provider from the various requesters in the form of care gaps and things like those. So we're really starting to think more holistically about it. So that's the clinical data exchange. The platform is really a technology that will accomplish a couple of things. One is that it's going to serve as the digital front door for MRO. What that means is we're automating and digitizing how requests and the actual delivery of the record happens between MRO and the various requesters when we're serving on behalf of a provider. The second bit, you can sort of think of it as it's the police officer who's directing all of the traffic of the various requests that are coming in and the records that are going out and how the records are going out. So we're digitizing a lot of that effort where we're looking in and seeing what patient is this request coming for what dates of service, who is this request coming from, are they authorized to get the request? All of that whole process, we're ensuring that we're building it in a scalable way and that it's digitized so that it introduces as little human error as possible. Now, payer exchange. Payer exchange is a product that sits on top of that clinical data exchange platform, as I said. What it is that it is an automated, fully automated clinical data exchange solution that enables us to really deliver on speed, accuracy, transparency, and security of the entire clinical data exchange process, from all the way from the digitization of the front door, like I said, from intake through the traffic cop process of directing all the records, the actual retrieval of the record from the EHR, and then the packaging and delivering and quality control processes that have to take place to deliver the record. Right now, we're really focused on risk adjustment. We've seen a really big increase in requests that are related to risk adjustment and HEDIS to a lesser extent. And providers are struggling with a surge in the requests that are related to risk adjustment. And we know that being able to have predictability is important for health systems. And we want to make sure that they take that worry about hiring staff to fulfill risk adjustment records, and that this solution will automate and take that over for them. So that's the first reason. The second reason or value proposition of the solution is, we are going to continue to share revenue with clients. That's a unique thing for MRO. A lot of solutions or platforms that are coming into the market promising to do clinical data exchange don't really recognize that HIM is a profit center for many health systems and really a strategic department for the health system to make money. So we want to continue to help the health system make money by sharing revenue where possible with our provider clients. We know that when we grow, our clients need to also be growing and benefiting alongside us. And then the third thing is transparency. With the increase in the types of requesters, the number of requests, the reasons that people are wanting clinical data, we want to hear our providers and we want them to be able to know who, why, and how are requests coming in and how are they going out. So Payer Exchange will provide very comprehensive dashboards that will provide transparency of all the data that is going across the platform from requester all the way back to the provider. So this is really to ensure that providers retain the power of the data that they manage, and also that they're able to develop a deeper relationship with payers in particular. We know that that's a relationship that's typically fraught and a little bit, it has a lot of friction. And so we want to provide providers with that data so that they know how these requests are coming in and going out. So we're very excited about all the development that we've done at MRO, Payer Exchange, our clinical data exchange platform, and there'll be more to come.
Mo, one of the old sayings is cash is king. And it seems like in today's environment, more so is data is king. because it impacts so many different areas, especially in the healthcare market. One of those is, just time is money. So the turnaround time that we're seeing with some of the breakdown in the barriers that have typically occurred in relationship to obtaining what now is becoming data used to be documents, and it was, copy those documents or reproduce the documents. Now this is moving, it sounds like, into true data that is machine usable in a certain respect, where it breaks down that time, and breaking down that time increases or decreases your labor. What do you see as the biggest labor savings here, or have you quantified what kind of labor savings that you anticipate for both the provider and the payers in this environment?
Sure. Yeah. This solution, because with our payer exchange that's sitting on top of our CDXP clinical data exchange platform, it automates and digitizes a lot of the process. And what it accomplishes for our health system is a couple of things. One is, as you said, the turnaround time is critical. So the turnaround time is shaved from weeks, sometimes months, that it takes to get some very difficult to get records, to days or even hours or minutes in some instances if it's a simple request. The other piece is that it enables us to release those requests in bulk. So no longer are we going one by one, going through every single request. So really, requesters can submit to us a whole slew or a chase list to us to deliver those records. And we can also similarly deliver them in that fast speed when we're ready to do so. Now, I also want to talk a little bit about the predictability that I talked about. So it's not enough for us to be able to deliver a quick turnaround. It also needs to be predictable. So as I said, there are these surges in volume demand. And in addition, for example, risk adjustment and HEDIS have a season. So most health systems just are in places where they can't go out and hire people every season. They need a way to predictably manage that demand and still be able to know when those data are going to be delivered. So that's what Clinical Data Exchange Platform that's powering a payer exchange solution accomplishes. It accomplishes the short turnaround and also enables the health system to have higher predictability in the data that they're delivering.
For that predictability and the seasonality of it, it has, over the past years, run in seasons. And it is either, I hate to say it this way, it's either feast or famine all the time. Meaning you get these big volumes of audit requests and demand on the system. Will the exchange allow for a more flattening of that roller coaster ride on the volume that's coming in, as well as being able to work? I know the machines don't care what time it is, in a certain respect. They don't go home at 5. Will this allow that volume to kind of level out and be able to work on a 24/7 period when the volume is coming in?
Correct. For bulk requests that we're getting from requesters, there's a couple things, right? One, I can't control when requesters are going to send us a chase list and say when they want the data. So that's out of our hands. What we do and are able to control is how that work is sequenced through the system so that it does not require manual labor that the health system has to manage. So that's where we do the digitization of the intake as well as the fulfillment of those records. So that's step one. The second piece, you put it right on the nail on the head. The beauty of machines is that they can work while we're sleeping. So clinical data exchange and payer exchange can work while we're sleeping and can operate and really fetch those records at any time as long as the data are available in the EHR. The other piece is the reliability of a platform, right? No longer are we having to rely only on staff to be able to deliver records. So God forbid we have another COVID-19. Payer exchange will just continue to operate just fine if there's a shutdown or anything of that sort. And we know the pain that we had to go through during the COVID-19 pandemic. This enables us to be able to deal with those kinds of shifts over time. And then lastly, we, unlike a lot of other players in the market, we maintain very strong relationships on behalf of our provider clients with payers. So our teams meet with the large payers in the country, sometimes weekly or even multiple times a week. And what we do with that, one, we're providing them with visibility as well and able to make sure that they're managing their work and their demands on providers well, so that payers are reducing provider abrasion. We know that provider abrasion is a big problem for payers, and they know that they have this relationship with provider that they want to preserve. So our kind of higher touch relationships, both with providers and payers, we're really trying to reduce that friction between the two parties and ensure that there's visibility, there's connection, and there's speed between the two worlds.
Mo, this is actually really exciting. It's going to solve a problem of, having that information for the providers, having the information also in exchange for the payers. And in addition to this, it's not a far jump to include physician practices and so forth. They are also not just the hospitals, but they are a provider that have high demands and high volumes of requests for information that they need very quickly. Typically, a patient is in their office and they need information. This sounds like it is a nice bridge, or will be a nice bridge, into satisfying that high demand of requested data for continuity of care in that case, where patients and physicians can get immediate satisfaction of the information they need.
Absolutely. And, with payer exchange, we're starting with risk adjustment because that's where the biggest pain today is. I mean, I imagine that that Medicare Advantage, for the first time, enrollment in Medicare Advantage is going to surpass Medicare fee for service, which means there are more people that are going to be enrolled in Medicare Advantage plans than there are in the traditional Medicare. What that means for providers is that there's just a whole lot more requests for risk adjustment and for HEDIS than they have ever seen. And the trend is not, I haven't seen anything that indicates that's going to slow down. So that's number one. The second piece that I want to talk about, we're focused on risk adjustment, but we'll be looking at patient requests. We'll be looking at continuity of care. So we know that providers have to deliver requests, medical records for different uses. So as we look at, let's say, patient requests, patients are rightfully taking back their power over their medical information. So there is much more heightened attention to sensitive information, to what types of records are being able to release, right? We want to ensure, even as we're digitizing these requests through payer exchange, that we're still looking at things like self-pay. We do not want to release records that a patient does not intend to be released. When it comes to sensitive information like HIV, some reproductive health items, so mental health, all those kinds of things, we want to make sure that we are quality controlling and not releasing information that is not intended to be released by the patient and their provider. And then lastly, there's other solutions at MRO, as you said, that we offer across the whole plethora of different types of providers. So, our release of information services, which we're calling Request Exchange, is really that full service solution that's been around. We've had this service for 20 years, and we just continue to improve upon it, build new technology, automate elements of it, so that we're really delivering that high quality disclosure integrity that's of high accuracy. Right now, as you mentioned, providers are not all created equal. We serve health system providers, we serve ambulatory providers, we serve some specialty providers in groups, and they all have different needs. And our solution is flexible enough that we're able to automate and also configure it for all those different needs. I do want to make another plug for other new solutions that we've launched at MRO, our ACO solution. So some providers have banded together and formed accountable care organizations. And we know that as those ACOs enter into risk-based arrangements with payers, they need to be able to manage all the reporting and clinical data required for their MIPS program or just to improve the quality. So MRO continues to evolve. We're really in accelerating clinical data exchange much more broadly. It's not only about ROI. While ROI is still important, it's our bread and butter. We are looking at other ways to really holistically serve the health system market.
Mo, this has been exciting to me, a conversation here, and very insightful. I know you got your hands full, but very exciting, times and development of these products that's going to move the needle, I believe, on behalf of our clients, the hospitals, the providers, and the payers. So very exciting stuff. This is, like I say, this has been a very insightful conversation, and I know it will be for our listeners. So thank you very much for joining the show today. It has been my absolute pleasure to have you on the show.
Thank you for having me, Don. It's been a blast.
For more insights on a patient's medical record, visit the show's page at MROCORP.com and be sure to explore additional resources and thought leadership on our website. Please check out our program on healthcarenowradio.com. And finally, be sure to connect with us on Twitter at MROCORP. Until we talk again, I'm your host, Don Hardwick.